Hello, good morning, good afternoon, good evening to all those viewers who are joining us today from all around the globe. My name is Zinat Islam, and I'm the Relations Manager Academia Network at Yunus Centre. Welcome to Lecture 2 of the YSBC Web Lecture Series. For those who are not familiar with the YSBC Web Lecture Series, these are fireside chat interviews with social business practitioners designed specially for students, academics, entrepreneurs, or for anyone who's interested in social business and wants to know more. So please also bring in your families, bring in your friends virtually for now, and join our sessions. We will have video recordings of the sessions also on our social media sites if you miss our previous ones. So please do check our Facebook page and YouTube channels for the recordings. Today's session is on the topic of the digital healthcare. The session title is Digital Healthcare, a Myth or an Emerging Reality which will force the redesigning of healthcare system. Our moderator today is Professor Cam Donaldson, Pro Vice-Chancellor and Yunus Chair, Glasgow, Caledonian University, Scotland, and Mr. Sajid Rahman, CEO, Digital Healthcare Solutions. Thank you, Professor Cam Donaldson and Mr. Sajid Rahman for being a part of this session. We appreciate your constant support. Thank you. We have many more sessions lined up like this in the coming days, and you will see in our slides the sessions and the date and timings for the upcoming ones. Now I kindly invite Professor Yunus to make his opening remarks. Professor Yunus.
Thank you, Zinat. I'm delighted to be here. And my job is to welcome you all to this second lecture in our series. We're all excited about the first one. Now we are super excited about the second one. We are looking forward to it. I hope you enjoy as much as I do. It's a fantastic opportunity to hear from the people who do it themselves on the social business platform, the social business ideas and so on. So today we will have an opportunity to hear from very important persons who are involved in healthcare social businesses and the ideas of social business and teach them, research them. Professor Cam Donaldson, who will be moderating, is a leading health economist and also dedicated to social business. He created Social Business Centre, Yunus Centre for Social Business and Health 10 years back in Glasgow, Caledonian University. He's a great friend. We're very lucky to have him with us. And Sajid Rahman, of course, is running this social business himself. They will talk about it. But what I wanted to point out, particularly in the context of the COVID-19 pandemic, it has revealed all the weaknesses in our economic system, in our health system. So if you look at the health system collapsing right at the beginning of the huge pandemic that conquered the whole world, you feel sorry that you have to surrender the whole healthcare system in such a way that it doesn't have much life left in it. So this is something that we have to address, the weaknesses in the system that we see and how to address that. And at the same time, to talk about how to bring the social business idea in the health sector. And this is what they will be discussing, both Professor Cam Donaldson and Sajid. And now I invite my good friend, Professor Cam Donaldson, to take over from here and start the conversation. I hope you enjoyed. I'm looking forward to their conversation. Professor Cam Donaldson, floor is yours.
Thank you very much, Professor Yunus. I just think that is a perfect introduction to this second YSBC lecture in our now ongoing series. It really then only remains for me to introduce today's star of the show, Sajid Rahman. Sajid was born and brought up in Dhaka, where he attended Notre Dame College and Dhaka University. He is Chief Executive Officer of Digital Healthcare Solutions, previously known as Telenor Health. Digital Healthcare Solutions is a social business built to deliver quality and data-driven digital healthcare solutions. Sajid is also an angel investor and a technology leader. He ran Standard Chartered Bank in various countries in Asia and Africa and led several mergers and acquisitions in that respect. And he currently sits on the boards of a bank, fintech companies, and renewable energy companies. He's a regular speaker and blogger on technology trends and has been featured at Financial Times, Bloomberg, Fortune, World Health Congress, Royal School of Medicine, a whole variety of important bodies events like those. And he frequently writes on technology topics. So it's time to come over to you, Sajid. I've deliberately just given only a brief introduction to Sajid because I think he will reveal more about his own background and as the talk commences. But Sajid, do you think you could perhaps start by just saying a little bit more about your background and how you came to work in the area of digital health?
Thanks, Cam. In fact, it was quite a generous introduction. Besides what you just covered, I think a couple of areas which might be relevant to today's discussion. One is, I'm a son of the soil. I was born, brought up, educated in Bangladesh, and then went on to work in different countries. One of the things that I've been very careful about as I built my career is to always take challenges. Places where usually people don't want to go, take a job there, take a challenge there. Let's say when I was in a bank, very few people want to go to Nigeria. They usually think, okay, we'll go to London or Dubai or Singapore. But I really liked the challenge, went to Nigeria to build the banking business there from scratch and stuff like that. So that's something I have been doing for a while now. When I was running the bank of Standard Chartered in Indonesia, I was getting a bit bored because it was sort of like doing the same thing in different countries. And then Telenor, which is a Norwegian telco, but has a strong presence with Grameen Trust, known as Grameen Phone, the largest mobile phone operator in Bangladesh. So Telenor hired me to build their health business globally. They have done something on the financial service side, but they wanted to do something big on health side. And so they hired me to do the job, which led me to come into digital health. The reason I liked digital health coming from a typical commercial banking is because of the impact it can do. It's a new area, and which we'll cover today. But at the same time, the impact a health business has on individuals is far outweigh what I could have done as a banker as part of Standard Chartered.
Yeah. And how did you then come to meet Professor Yunus and be interested in social business?
Everyone knows Professor Yunus. So, obviously I have heard a lot about him. My first professional interaction was actually related to when I was working in Telenor Health. Professor Yunus heard about what we are doing. And someone from his team who runs a part of the Grameen family reached out to make a presentation to Professor Yunus and all the managing directors of different units. His idea was that how digital health can be integrated to Grameen Kalyan or other Grameen organizations. So he invited the team and we went and presented to him and the whole MDs. And like they say, the rest is history because from there, we are now basically working very closely with him as part of the Grameen family.
Yeah. Fantastic, and it's an amazing partnership. Probably even a little bit like me. Perhaps not all of our viewers and listeners are aware of or fully aware of what digital health is. Could you just, maybe it sounds like a bit of a silly question, but could you maybe say what digital health is and how might we define digital health?
Actually, it's a very, very important question because. And I think the answer to that question essentially shows the potential of what digital health can be. As the name suggests, anything that we can digitize helps us to expand that in an exponential way without compromising quality or increasing cost. So if you think of a healthcare service end to end, if there are components of healthcare service that we can digitize, then we can actually arrange that particular service distribute to millions of people without incurring much cost. So what digital health does is digital health takes part of the healthcare journey and digitize it and ensure that that becomes the front door of healthcare. Now, just to give you an example where it can become very relevant. One of the big challenges of healthcare is what we call last mile of delivery, right? So we hear of, we buy books from Amazon and others, and then the question is how we get the book, the last mile, right? Now think of the last mile of delivery for healthcare. These are essentially the clinics at the villages or doctors' chambers at remote parts. But then there are places where those chambers are not there, those clinics are not there. Now, if we can digitize that last mile of delivery of the service, then suddenly we unleash a huge capacity. A doctor sitting anywhere in the country or anywhere in the world can consult a person who is at a remote parts of the country. And then what we are saying is we are bringing in people or the doctors who are not typically in the healthcare service coming in because of the digital way of delivery. So that's sort of probably a good way to understand what digital health is all about.
Brilliant. And then getting into perhaps some specifics and examples. Let's take Bangladesh, for example, a really good example. I mean, so for how many years has digital health been in operation in Bangladesh? And for example, how many clients do you reach out to? That kind of thing. How many calls might you have in a 24-hour period?
So we started in 2015, so roughly 5 years. We launched our first product or service in 2016. We have roughly 6.5 million, service members who we're servicing right now. The call number varies, of course. With COVID-19, the call number has gone up, but we usually get anywhere between 2,500 to 3,000 calls a day. That's through our own channels, which is either over phone or video or chat app. But we also are managing one of the helpline, IEDCR helpline, as part of the government initiative. So we get another 1,000 or so calls there.
Right, and I presume also it's still growing. So do you know, like, say, for example, how many new clients you're bringing on board per month or per year?
So, yeah, it is growing. I think we get anywhere between 35, 40,000 every month, new clients. The other thing that we are noticing very interestingly is the existing clients are using our services more and more. So if we look at, if a person was calling our doctor for the first time, the person calling back again is almost 65 to 70%. So, so the callback rate or the person coming back trying to get the service is more and more. We are also seeing the people who are spending times with doctor, the time is actually increasing. When we launched the service, it was roughly 2.5, 3 minutes. Now it is almost 4.5, 5 minutes and growing. So the indicators that shows that the customers are actually getting value out of it, I think most of those indicators are positive for digital health services. Right.
That kind of takes me on to my next question. I mean, in part, you've kind of answered this by what you've just said, but also some of your earlier comments. But it was really just to say, like, what is it that customers see as special or so special that makes them go to digital health for its service? I mean, some of that might be quite obvious to some of our viewers and listeners, but there's probably some things that might be surprising in there as well. And are there any special programs you can give us examples of in those regards?
Yeah, I mean, I think one way to look at is the services, the different buckets of services that we are providing. First, of course, is the consultation or access to doctors over anytime, 24/7. And in a country where you do not have enough doctors per 1,000 population, we are 1/10 in terms of number of doctors compared to what World Health suggests. So clearly, having a doctor at a fingertip 24/7 is a significant advantage for many people, right? So that's one of the core anchor services that we are offering. The second is health insurance. So one of the things many people in markets like Bangladesh, and of course across the world, in many emerging markets, is that they don't have enough health insurance. So a lot of people actually go below poverty line every year, because what we are seeing is non-communicable diseases is actually going up significantly, right? So because of the food habit, the lifestyle and everything. And because NCDs have a significant financial burden, unless it's covered by some sort of safety net like health insurance others, they go below poverty line. So we have a strong health insurance component as part of our service. The other thing we do is essentially people can book an appointment if they want to meet a doctor physically. So that one. We have, also if people want to do a sample, let's say pathology test, lab test, we go and arrange sample collections. The other thing is about, let's say after a doctor's appointment or doctor consultation, doctor wants to prescribe a medicine. And if the patient wants, the medicine actually gets delivered to their home. So what we are trying to do is to build a continuous, ecosystem where the different components of health services and the last mile delivery of it is digitized and expanded, exponentially, which makes us do two things. One is, tap on the capacity factor that was not available before. So just to give you an example, what happened is during COVID-19, because we've had a sort of a call center structure where doctors came and sit and give a consultation, right? But our doctors say that, look, I mean, because some of them also go and practice to clinics and others, they said it's risky because if they have COVID-19, they will infect other doctors. So what we did is we changed the technology upside down and make the technology distributed. So a doctor can now consult from his home or his clinic where he's practicing. Now think of how much capacity it opens up, because then what we are seeing is a lot of women who actually go to medical school and has a degree. So if you look at the medical school, students, the female population would be roughly 25–30% of the students. But if you look at the female doctors, it will be less than 10%. So what we are seeing is a large group of female who are very qualified, have the right degree, but because of various reasons cannot practice. With this system, we can actually bring them in, and that will unleash a huge capacity factor for countries like Bangladesh.
Right, that's really interesting, because that's changing the labor force or the workforce in many respects, isn't it? And it's not only doing that, but presumably a more gender balanced workforce is better able to meet the needs of the population.
True. And the other example of this would be, let's say, what's happening globally is that we are getting more and more conscious about our health, right? So we are trying to flip who owns the data and who does the self-diagnosis. Now think of where one of Professor Yunus's vision is that we equip remote parts of the country where people can actually get the basic health data, right? Now think of if we can collect those data with the digital health, we can actually connect the source of data to a doctor's at a center. And then we are unleashing a huge capacity, because then a lot of the early diagnosis that gets lost because person doesn't have access to the diagnostic facilities are going to go away, because we are now enhancing the whole value chain end to end.
Yeah, fantastic. Now, what about sort of financial performance? I think some of our viewers and listeners will be interested in issues about things like annual revenue. Is it up? Is it continually growing? It sounds like maybe from the numbers you've been speaking about that there might be some quite obvious positive answers to that. But then there's issues about maybe financial break-even points. Is the social business aspects at that kind of point as well? Just questions like that. I think some of our folks will be really interested to hear about.
Actually, before going to the numbers, I know you are keen to hear that, but let me first break a myth which I had, and I'm sure most of the people who are hearing it may not have it, but some may have. Is sometimes there is a feeling that social business is not business enough, because there's so much emphasis on social good. But at saying that, if I was running a Telenor Health or the digital health in the previous version, which would be very much of VC centric, right, venture capital centric, which actually goes for growth at the expense of P&L. And I'm sure you know that there are hundreds of examples like that around the world, where companies grew exponentially, but without having proper focus on P&L. Social business actually bring the lens very clearly on that particular point, which says that a business must be self-sufficient over the long term, because it's not just for the growth, it has to be self-sufficient growth. And that's where I think as we transition to social business, we have a very clear focus on how soon we can be self-sustainable. We are looking at roughly 2 years from now, so end of 2022 or early 2023, by which time we'll break even. Our revenue comes from 3 sources. First is obviously individuals buying our services, different types of services. It includes unlimited consultation with doctors or insurance and stuff. The second bucket are people who are buying it for their employee base. So we have cases where the garments factory owners are buying it for their 5,000-10,000 garments employees, or a security guard company buying it for their 10,000 security guards. So that's the second group. And the third group is where we work closely with different partners like UK Aid or others, where we are undertaking some projects for really disadvantaged people of the country. So these are the 3 brackets of our revenue. So our revenue roughly this year will do roughly $2.5–3 million.
Right, that's great. So that last point about the different categories of customer, if you like, was your answer was beginning to make me think about that, and I just wondered if you could elaborate a little more on that with respect to how people achieve access based on different degrees of wealth or poverty. Is it possible just to say a little bit more about that?
Sure. So one of the things that we are seeing in most of the markets is that there is a huge mobile penetration. Right? So in markets like Bangladesh, where we are talking about 110 million connected in mobile network. Now, what we are doing is we are making the service on top of the mobile platform, so anyone with a mobile phone can get access. Now, the question is that are we talking about smartphone? No. So we are talking about any regular phone, feature phone can get a consultation or a health insurance or most of the services that we offer. So we are agnostic in that way, because we know that a lot of people don't have smartphones. Of course, there are services which are app-based. So if someone wants those, they will need a smartphone. But most of the services, almost 80 to 90% of the services can operate on feature phone. So that's one. The second thing that we are doing is, as we build the digital health, we are also connecting to a lot of smaller clinics across the country. So, one of the sister organizations that we have is Grameen Bank. So one of our projects is essentially to connect our digital health services to the people in the Grameen Bank at remote points of the country. That serves 2 purposes, because we might have people who are still not comfortable with mobile phone. So they can go to the nearest Grameen Bank center, and then the person on the ground can connect to a very specialized or well-qualified doctor in the center. So that way, we are distributing this service to remote parts of the country, even when there is a challenge in terms of mobile network.
Right. So you're connecting not just customers with the system, but you're connecting different parts of the system with each other. Is that what you're saying? So a doctor over here can connect with a doctor over there.
Yeah,
type of thing to get a better quality of answer to whatever the question is.
Yeah, and so the whole idea is to actually build an ecosystem. Right? So the person at the remote points may not be a qualified doctor, but maybe a nurse or paramedics or something like that. So the question is that how do we give the person at that remote point that last mile where a qualified doctor isn't there, but we have someone who can do the basics, taking temperatures and blood pressure and stuff like that, and then feed this data to a center. So the way it will work is that digital health is not going to be end-to-end, because there will be healthcare services which cannot be digitized. But then the question is that can we make the service or the health experience continuous from online to offline as a person goes through the healthcare experience? Right,
amazing. So let's move a bit to the future now, and I suppose in general, like if we're still, let's take in Bangladesh as an example or a model country, how might you see the future of digital health in countries like Bangladesh?
I think it will. I think the adoption will obviously grow. Now, one of the examples I usually give is, if you look at any internet business, the big challenge is behavior. So we have people who were, before Google was there, they used to go to libraries Now, any information, the kids go to Google, right? Whether it's good or bad, that's a different discussion. But of course, people are moving more online than actually reading books. Now, what is happening is, especially with COVID-19, because access to hospital was difficult. So we are seeing a lot of people are now using a digital method of accessing services, including healthcare. And Bangladesh is no different. I think that will continue to happen, and people will become more and more adaptable with healthcare services. The second thing that I think is going to happen is, hospital as an institute is going to be bundled out. So, hospitals now do a lot of jobs which are not their core competency, but they build in all these jobs because it helps to maintain the business of healthcare. Now, what we can do is take some of these services as digital health, like from appointment booking to medicine delivery to pathology collection, stuff like that, as well as consultation, which will make a lot of hospitals only focus on their core jobs and not focus on other areas which are not adding value. So that is also going to happen over time.
Right, and is there much? I mean, it's obviously it's growing. That will attract competitors. Is there much by way of competition? How many other companies are providing these types of service, and how many would the combined sector then begin to reach?
So, I mean, there are in Bangladesh context. So let me first look at the global context and then Bangladesh context, right? So in the global context, we do have companies which are called Doctor on Demand and others, which provide access to doctors. And then we have companies which provide some of the appointment booking. We have companies which provide some of the health insurance and stuff like that. But I am not aware of any company which does the whole gamut of services that we're talking about, because I think the benefit of building a business in Bangladesh is being able to really build a service at large scale because of the number of population, as well as the lack of services in different pockets that we could build that. So that way, I think we are quite unique, in a global context. In Bangladesh context, we have a couple of companies which are, again, working on different points of the service, but not as comprehensive as we think we are. But saying all that, I mean, I should be very clear that the healthcare service and the challenges on healthcare is so big and so deep. Any competition is welcome, because I think no one company or no one institute can actually crack this. So there has to be a lot of private sector entrepreneurship, public-private partnership, and other donor agencies. Everyone needs to work together to crack this problem.
Right, because it was, as you were speaking, I was wondering about if there was in a sense maybe a threat to the social business model of delivering digital health. But it sounds like maybe not. Is that what you're saying? There's room for everyone. There's potential for partnerships. Any further thoughts on that?
Yeah, I mean, I think I don't see it's a threat to social business model because of two reasons. One is, the idea of social business is to be, self-sufficient, self-qualified. So that remains, right? So even if we partner, we have that as a core hypothesis of what we do. So that will continue. And I think the overall overarching social angle of the business will actually bring us to the forefront, because that always means that we will not do things just for the sake of profit. So that actually builds credibility and accountability in the longer term. And in a sensitive space like healthcare, we really need to build the trust. And I think that accountability and credibility will build the trust in the long term and will actually help us compared to any competition who comes in just for the sake of profit.
Yeah, okay. And then moving sort of like really wide, like internationally, where do you see digital health fitting into the overall health ecosystem? Can it replace any elements of healthcare systems successfully? What would success look like for digital healthcare globally?
I think so the way I see the whole evolution will happen in digital health is like this. I think first would be obviously access to doctors, and that would mean that doctors would become more independent, right? So doctors, would like to, serve when they want to serve, would like the flexibility of serving, and they may not always be attached with hospitals, right? So one of the big challenges of independent, doctor practitioner is the is the flow of patients. So if doctors become independent and servicing more and more, the digital health service actually offers them the patient, because then they have access to the whole country or community. Now, a byproduct of that would be a more transparency of the quality of service, of the quality of diagnosis by the doctors. Because as the doctors go more independent, they need to create more and more trust. And the more data people have, knowing which doctor is good and which doctor is bad, will actually create a better transparency on the services offered by different doctors. So that would be the second thing. The third thing I think will happen is, as digital health becomes more and more integral part of the healthcare, a lot of the data that are collected at patient points will create a core component of doctor's diagnosis as they move along. So, so idea of getting individual's heart rate or blood pressure at the point that's happening, and then getting this transmitted at a central point would actually create a huge database that will bring a lot of diagnosis much more easier and much more to the patient. So in the long term, I see digital health to be a very integral part of the healthcare journey of any individual, sort of like a continuum where digital health sort of is the point of entry. And from there on, it touches different points by providing data of the patient's journey.
Yeah. So I think I might come back to some of that towards the end in a kind of COVID type of context. But what I wanted to do next was pick up on some of the things that you've already alluded to, which is basically potential for digital and physical collaboration. And for example, you've mentioned with Grameen and other, perhaps also with other local occupational health facilities and caregivers. How did the collaboration with Grameen come about first of all, and then maybe we can expand it a bit?
So initially, so when we were, working on the healthcare model, on the digital health model, one of the things we realized is that somehow or other we need people who can, because the key component is the individual's patient data. And many cases, the patients may not be, qualified enough to get those data on their own. So the question is that how do we then empower the person at the remote part and get the data from there? So there are different ways to crack it. One is obviously, we can have people with and which is one of the model that we're looking at, people with sort of like a, very small box with different type of, basic equipments going around and collecting data. The other would be, equipping the clinics at the point to collect those data, right? So that's where we think a very clear, symbiosis happened there. And then that's what we're looking at, a very good complementary services coming together. And that's what Grameen Kalyan offers, because they have a large hospital, large clinics, that's where we see there's a lot of cooperation there.
Yeah. And then with respect to other sort of local occupational health facilities and caregivers, are there other sort of types of partnership in those kind of respects?
Yeah, quite a few actually. So we have a partnership with a lot of labs because so one of the lab is ICDDRB, which is a well-known center. So we work with them to collect samples from different points. We have another large organizations where we help them, where we actually help their healthcare worker, like Care International. So with Care International, we help their healthcare worker to, they are not actually qualified doctors, but healthcare workers, and essentially with our products, they can complement their income and essentially, become more self-sufficient. So that's another one. And of course, we have a lot of partnership with pharmacies across the country.
Yeah. So this has all been really positive and upbeat, but of course, as a dismal scientist, as an economist, the dismal scientist, what do you see as sort of limits on digital health initiatives in countries like Bangladesh? The possibilities sound immense, but do you see sort of limits or limitations on it?
There are. So now the half empty bit of it, right? So so I think there are a couple of. One is of course the data, or how to collect the real customer information, right? So our technology is not good enough. We still have to, we have not improved enough to get those real data. So that's a problem. Second is, of course, there is still this huge cultural and behavioral things that we need to overcome, because people still feel much more comfortable with a doctor taking their pulse or measuring their heartbeat and stuff like that. So this whole behavioral thing is a big hurdle that we need to overcome. And the third, of course, is the confidentiality of the data, right? So a patient data is very confidential and very sacrosanct. So unless a company is built keeping that in mind, to keep the confidentiality and secrecy and privacy of those data, then it becomes a challenge. The fourth, I think, would be a big issue, which we call self-sovereign identity, i.e. how do you actually identify an individual very clearly whenever we come to patient data or health insurance and part of it, right? So the more we can do that, or the more we can digitize this identification process, the better. So there are huge obstacles that we need to face as we build this service.
Yeah. And what about, are there any kind of like ethical issues, data sharing type issues, a lot of which are coming to the fore right now?
So when we started this this whole service, that was a very critical component of it, and because we are at that part of Telenor, which has this whole GDPR thing in the European context. So what we had to do is we had to follow those regulations compared to the existing regulations of the country. So we were a bit more careful on the data privacy and secrecy of it, to the extent we actually have a clause where a person can decide to delete their data on the system. So so a person can opt out for that. So we have that level of built-in terms and technology to ensure that the patient is comfortable enough to share data with us.
Yeah, good. So looking even further ahead, what do you think we should see as the potential for digital health to basically redesign healthcare systems? Can we look forward to even greater international collaborations with doctors, hospitals, digital healthcare services?
Of course. One of the Professor Yunus's vision was to not only thinking of hospitals, but individual's home, a bed, turning that to be a hospital. So essentially empowering the remote parts of the country in such a way that becomes an immediate, continuous flow of information about the individual and a regular data and a regular service, i.e., we have a lot of cases where a person either before coming to hospital or after released from hospital need a lot of services, and can we turn that into a sort of a hospital, right? So that's the sort of the holy grail or the ultimate goal that we all should aspire for. And of course, in doing that, we need to collaborate, locally, internationally with different partners. There are so many things that are happening globally, which we can learn from. And there are best practices that we are developing in Bangladesh that the others can learn from. So I think it has to be a very collaborative approach across countries and across different parts of the society. So
yeah,
it's the only way to do this.
I've noticed just things flashing up on the chat about some people are interested in the kind of the actuarial sort of science behind it. So that's probably, in a sense, that's getting at how we can influence things like health insurance coverage through digital healthcare, and what the implications might be there. Sajid, are you able to offer any observations on that?
Sure. In fact, when we started this health insurance, it was such a low cost that I got approached by some very well-known insurance companies that how are you even doing it, right? So just to be clear, we don't underwrite. We have local insurance companies who underwrite it, but for all practice purposes, we help them develop the model. We have senior actuarials who helped us do it. So the way to look at it is this: we reduced a lot of cost from the insurance journey. So a person, when they submit a claim, the person doesn't need to come to any center or anything. The person can just take a photo and upload it through a messenger app in Facebook, right? And then it is a completely online process where the claim comes at the back end, and the back end there is an AI which sees whether there is any fraudulent attempt or not, because optical character recognition in Bangla language. And based on that, it gets approved, and then the disbursement happens again through mobile wallet into individual, right? So we are not talking about any intermediaries in between which takes cost. In terms of premium collection, that also actually happens through airway bill. So it's like, you have your mobile phone bill and you see a line item like that. So we have reduced a lot of cost in the process. The second thing that we did, and the way to look at it, is a public health, not as individual health. So when we are, from an actuarial point of view, when we are insuring, let's say, 5 million people, that has a very different actuarial model compared to when we are giving insurance to individual people, right? So that's one of the ways we have been able to significantly bring down the cost.
Yeah. So this has brought together, in a sense, your kind of fintech skills and experience with your health and healthcare experience, and hasn't it really, in many respects? Yeah.
I mean, I think so all service has a financial service component, right? So the way we are seeing it, even if when we are talking about giving doctors a virtual clinic, then there's a fintech component of how to make the whole payment very easy. So what we have done is we are a health company, and health is the core service that we offer, but we have built in a lot of fintech component in the services to ensure that the customer's journey is end-to-end, very smooth. The whole idea has always been that whatever individual experiences outside digital health, we offer a 10x better experience, whether it's whether it's a consultation, whether it's a payment of insurance premium.
Yeah. Now, I mean, in my experience and thinking about things like social business in countries like Bangladesh, to some extent, they've been a vehicle. It's been a vehicle for, it can be a little bit controversial, allowing people to advance their lives in ways that private sector has not traditionally been interested in, and also because there's been an element of kind of government failure as well. The government failure might be related to just lack of resources to maybe cover the whole population if we're talking about things like healthcare. So, but it does lead to the question about what's your relationship with government in this respect, whether it's in Bangladesh or other countries, in terms of their support, not just intellectually and philosophically, but also perhaps more materially for what you're trying to achieve.
So let me touch 2 points. So first, on your first assumptions of the failure, right? So I think there is a question of very clear market failure across the world, right? So and the reason for that is this: we have the same group of people who actually operate the largest healthcare, i.e. government clinics, responsible to finance those healthcare, i.e. ensuring the resources, and regulate those healthcare, right? So, if you have a regulator, financier, and operator as the same institute, then, obviously there is a market failure on how to manage it properly. So, and I think that's true for many countries, and similar in emerging markets. In case of our government, actually, we are working very closely. So one of the things that we are doing is IEDCR, which is one of the premium source of COVID-19 related tests and stuff. So we have started ourselves, and Johns Hopkins University has started managing that helpline. So that was a very, very strong partnership with the government, as well as, we are working not directly with government, but one of the very important hospitals in Bangladesh to start collecting COVID samples for COVID related PCR tests and stuff. So in different components, also, we are working with the central, one of the organizations in government in terms of, when we launched a symptom checker at the early part of the COVID-19, we were giving those data to a central government database, so the government knows, where are the people with the COVID-19 symptom stuff. So in many ways, we are working closely with different government agencies.
Great. You might not be aware, but we've been going for 40 minutes now. I did want to just spend a few minutes just reflecting on COVID-19. I mean, you have actually reflected on COVID-19 throughout this discussion anyway, but I think there are kind of obvious parallels in the sense of like this digital world, which now a lot of us who perhaps were, of which a lot of us were perhaps less aware even just a few months ago, we've kind of now launched into it. You're way down the track. But I just wondered if just reflecting on the pandemic, if you had been drawing those parallels and what you would see as what it might mean kind of going forward with respect to digital health and in terms of the implications of COVID-19.
So, yeah, so what everyone is now more or less recognizing are two things. You know, we heard about W and U and V, different shape of recovery. So I think there is now a general hypothesis is that it will be a K-shaped recovery. So one group of people will actually, you know, will become richer and more coming out of the pandemic, another group will go, face severe financial challenges, right? So in a K-shaped recovery, I think access to healthcare becomes very important and affordable and quality healthcare. And that's where I think digital health brings in a lot of insights and delivery of the services. The second thing COVID-19 has done is it's accelerated. Whatever was happening, it just accelerated those change, whether it was good or bad, I think. And that's what I think we are seeing across the world. We are seeing companies which were basically almost had a bad business model or almost was going to be bankrupt, is now pushed to bankruptcy, right? So and then we are seeing companies which are sort of had the right business model are still going along and surviving. So the way I see digital health coming out of this whole pandemic experience are two things. One is a general belief and acceptance by a population that digital health can be a very good source of initial entry to healthcare service. So that's one. And second, I think there will be a lot of regulatory overhaul on how digital health is viewed. I mean, if you notice that in US, there is already changes in regulations to provide insurance cover for digital health, to allow doctors to do consult across states. So there are a lot of regulatory framework that are now being alongside digital health. And I think those framework is going to really put digital health in the map.
Yeah, yeah. And do you think, I mean, has COVID-19, I sometimes wonder, like how far behind we are in countries like the UK, partly because of the, due to an element of complacency, really. So in the last few months, it might be that, well, maybe we've become more connected in countries like my own, but would that have parallels in countries like Bangladesh? Or what I'm getting at, I suppose, is that you go to Bangladesh and you see like people seem to be connected in all sorts of ways that we are not. And I just wondered if you were able to reflect on that as well.
Yeah, I mean, first of all, don't feel bad about UK. I mean, healthcare is broken globally. So it's nothing specific to UK. It's a big challenge. I mean, I think so what they say, and this is true across markets, is that because a lot of the countries like Bangladesh are mobile first, so you have a generation of people who never seen land phones, right? Because there were very little land phones, right? So we have a generation of people who are actually doing mobile first. So they're your young kids growing up with mobile on their hand. And that we are seeing in markets like Bangladesh and in Africa and Latin America, where mobile is so pervasive and connected. So a lot of the services are built on top of mobile rather than a typical, offline and then moving to web and then other places, right? So that's where, your perception is probably correct, that a lot of these countries have more people connected via mobile phone than maybe many developed markets.
Yeah, yeah. Which I think then means that there's great capacity there to have you say healthcare is broken, but to build potentially a fairer healthcare system. And
a better, right? So, the whole idea is not to go back. So
yeah, of course, yeah. You talked about quality early on, of course. Yeah, don't go back due to
Professor
COVID-19.
So let's take this opportunity to build a healthcare which is more equitable, more better in quality and more better distributed to the people in need.
I think that is a brilliant point to finish on, and I think this just makes what we've just spoken about a whole other arm of Professor Yunus's idea of no going back. So I mean, all I can say, Sajid, is on behalf of the YSBC community and our wider set of viewers and listeners, is it's been a great privilege just to be able to spend this time with you today, and to thank you for giving up that time to spend with us. Thanks so much.
Thank you, Cam. It has been a pleasure.
Thank you.
Thank you very much for such an enlightening session. I'm confident our audience members will greatly benefit from this conversation, and many will even act upon it. So thank you very much, Professor Cam Donaldson, Mr. Sajid Rahman, for being a part of this session. I would also like to thank our audience members for participating. And if you have any comments, questions, feedback, please email us at ysbc@yunuscenter.org. Many of you have posted in our chat box questions, comments. We'll of course address them. We may also come back again in future dates with more speakers, repeat speakers addressing the points you have raised, the questions you have raised. So thank you very much. Now I would kindly request everyone to turn on your cameras if you haven't, so we can take a group screenshot. So if you can kindly keep your cameras on and look at the camera and smile, we'll take a group screenshot. This will take about 30 seconds, so please go ahead. Yes, I think we are done. If anyone wants to take any last screenshots, please go ahead. Okay, thank you very much. Thank you very much again, everyone joining from all over the globe and attending our YSBC lectures too. We have many more coming up, and you will see slides which mentions the date and timing and the speakers of that upcoming session. You can find all our updates on our social media pages on Facebook and Twitter. Our recordings will also be on our social media pages, Yunus Centre Facebook page, the YSBC Facebook page, and we look forward to having you all again. See you soon. Thank you very much. Stay safe. Thank you. Thank you. Bye-bye, everyone. Bye-bye.
Thanks, Zaina.
Thank you. Thank you, everyone.
Bye. See you.
Thank you. Cheers, Sajid, and hopefully we'll speak soon.
Yeah, sure.
Bye.
Thanks, Zina. Thanks.